I just want to start out by saying that the Utah Parent Center is so excited to have these guest presenters this evening in this workshop entitled Fidgets, Headphones, and Brushes, Oh My, addressing sensory needs in the school system. We hope you find this information inspiring and informative. Before we get started, I'd ask that you enter your name into the chat box. And because there's going to be a lot of us tonight, I ask that you please keep your video off and you yourselves muted to just help with the bandwidth. If you do have questions, please put those in the chat and we will be able to get to those towards the end. So my name is Leslie Hansen. I am a parent consultant at the Utah Parent Center. I am the mother of a wonderful boy who will be turning 13 years old soon. My son has some developmental disabilities, and with that, he also deals with some sensory processing issues. So at the Utah Parent Center, we are parents helping parents. So each of us is a parent of a child within special education. So we understand from the parent perspective what it's like working with our special education teams. We do one-on-one consultations and present workshops throughout the state, and all of our services are free. Utah Parent Center is a statewide nonprofit organization that helps families navigate special education. And with that, I would like to introduce our wonderful guest presenters tonight. Sarah Gray, OTD OTRL, is an occupational therapist with 20 years of experience, mostly in pediatrics. She graduated with a Master's of Science in Occupational Therapy in 2001 from Colorado State University. She has 15 years of experience as a school-based occupational therapist, as well as 6 years of outpatient practice. Sarah returned to school and earned her doctorate in occupational therapy in 2018. She serves as clinical faculty in the Department of Occupational and Recreational Therapies and the clinic director of the Life Skills Clinic at the University of Utah. In addition, Sarah holds a certificate of certification in comprehensive behavioral intervention for tics and works with patients that experience functional difficulties as a result of their tics. She also studies sensory processing and sexuality in autistic adults as the capstone project when she was in school. Personally, Sarah is the mother of 4 young adult children and a large fur baby. She loves to travel and hike with her husband, watch sports, and listen to music. Rhonda Roth is an MOT-OTRL. She has been a pediatric occupational therapist throughout the Western United States since 2007. As a graduate of Colorado State University with a BS in Psychology and Samuel Merritt University Masters of Occupational Therapy, Ms. Roth found her passion for helping children during an internship in therapeutic horseback riding during her junior year at CSU. After graduating summa cum laude from SMU and her Master's of Occupational Therapy degree in 2007, Ms. Roth continued to grow her experience and expertise in pediatric occupational therapy services. Since 2007, Rhonda has worked in a wide variety of settings, including early intervention for children aged 0 to 6, sensory integration clinics, hospital-based pediatric outpatient clinics, acute care, skilled nursing facilities, and in-school-based occupational therapy. Ms. Roth also successfully owned and operated TheraPlay of Colorado, an early intervention company from 2008 through 2013 in Arvada, Colorado. Upon moving to Idaho in 2014, Ms. Roth founded Children in Motion, a continuing education company for early childhood educators. After 4 years in Idaho, Ms. Roth moved to Cottonwood Heights, Utah, where she has served as an instructor and staff member at the Life Skills Clinic at the University of Utah since 2018. Ms. Roth currently holds certifications or has completed additional post-professional training in the following programs and specializations: Handwriting Without Tears, Certified Handwriting Specialist, Level 1 Mentor Clinician in Sensory Integration at the STAR Institute, Boliviacs Trained Therapist, Interactive Metrodome Certification, Adults and Children, Vital Links Therapeutic Listening Certified Provider, Level 1, SOS Feeding Certification, Level 1. In her spare time, Ms. Roth enjoys reading, watching British mystery shows, hiking, camping, and horseback riding with her husband and her preteen daughter. She also enjoys hanging out with her at home with her family's two cats, Stephen and Kit Kat. And now I will turn the time over to Sarah and Rhonda. Thank you so much.
Thank you, Leslie. We're so excited to be here. So I'm going to go ahead and share my screen with everybody so you can see our presentation. All right, so we will go ahead and start talking this evening a little bit about sensory processing in the schools. And as Leslie said, if anybody has any questions, please feel free to just put those questions in the chat, and then we will be sure to answer the questions at the end. So I know we have some of our past OT students here and some current occupational therapists, but for the parents out there, just a quick overview of what is occupational therapy. OT stands for occupational therapy, and we can work in a variety of settings. So you might see an occupational therapist in an outpatient clinic for adults or children, in hospitals, schools, early intervention from 0 to 3, and then 3 to 6 years. So we serve a variety of purposes. Our main purpose as occupational therapists is to really help people to be able to do their daily activities and their daily occupations and to be able to engage in those successfully. So our organization, the American Occupational Therapy Association, defines occupational therapy practice as a holistic perspective in which the focus is on adapting the environment or the task to fit the person. And the person is a very important part of the therapy team. And certainly in our view as occupational therapists, as parents of children who might require occupational therapy, you're also an integral part of the therapy team. In schools, we help children to fulfill their roles as students and prepare for college, career, or community participation. So we might work on health prevention, so preventing disease and further disability. We also can work on health promotion and also the ability to build skills for access to whatever it is that your child wants to do in the future. Okay, so we're going to move on. We're going to chat a little bit about what is sensation. And so Webster's dictionary, I always kind of laugh, but I like to put that in there. Webster's dictionary basically says that sensation is a mental process, awareness of stimulation, and a state of consciousness. So in preschool and kindergarten, we learn about all of our different sensory systems. So we basically talk about the 5 senses. We talk about hearing, which is your auditory sense, taste, which is gustatory, sight, which is your visual sense. We talk about touch, which is tactile, and smell. But there's 3 more senses that we don't often talk about with our children. And so those are important ones to understand as well, especially when we're considering children who have sensory processing problems. So the first one is proprioception, and that's our big fancy word for knowing where your body is in space. So you can see we've got a picture here of a woman who's trying to touch her nose with her eyes closed. And so kiddos who have a hard time with proprioception, they might seem clumsy, they might trip over things a lot, they might just always seem unaware of the environment around them, because what they're really doing is spending a whole lot of time trying to figure out where their body is in space. You can also see that I put a picture of a broken pencil, and that's because our proprioceptive system also takes care of our force modulation, and so how hard you push with something. So a lot of times in schools especially, we get referrals for children who wear out their hands get really, really tired after writing for a really long time, or they're constantly breaking their pencil tip. Or wearing their pencil tip down. And that can be secondary to a problem with the proprioceptive system, not feeling that table pushing back against them and not knowing how hard to push with their pencil. Our vestibular system is another system that's really important, and it is our movement system. It tells us which direction we're moving. It tells us which way is upright. And it really works closely with our visual system and also our auditory system to tell us which way we're moving and how fast. So our vestibular system is key in detecting movement, in making sure that we don't get car sick. So a lot of our kiddos who have vestibular processing problems will get car sick really, really easily. We'll have a hard time with balance activities. or may get dizzy very easily, but then some not at all. And we'll talk about that a little bit too. And then our last sense system is the interoceptive system. And I call this the 2-year-old sense because it's the sense that tells you that you have to go to the bathroom, you're hungry, that you're thirsty. So I call it the 2-year-old sense because those are the things you hear with a 2-year-old on a car ride, right? Like, I'm hungry, I'm thirsty, I have to go to the bathroom. Those are the things that your interoceptive system tells you. So these are really important to know and understand as we're going through our talk today, and also to start to kind of think about for your child, what might those sensations be that your child is specifically having a hard time with. Okay, so those are the senses, but when we're talking as occupational therapists, we are talking about sensory processing, and that's a little bit different. And so this is a little picture that I like to use to explain to people how sensory processing works. Basically what happens is when you get a sensation into your body, such as a smell of pie, the smell sensors in your nasal system are triggered and are sending signals to your brain that say, hey, we smell something. And so then once that information gets to your brain has to decide, has to make some decisions, right? So it has to say, what is that smell? What do I do with that smell? Do I like that smell? Do I not like that smell? Am I hungry? Do I want to eat pie? Do I not want to eat pie? And then we have a possible response. So your response might be to eat the pie. It might be to salivate. It might be, oh, I'm really full after my lunch. I don't want to eat any pie. Or your response might be, oh, that's cherry pie and I really hate that. Yuck, right? So every time you have a sensation, this is the system that is working. And really, when we're talking about sensory processing, we're talking about your nervous system. And right, that's the system that we often hear called the fight or flight system. It's the system that says, hey, I'm out in the woods, there's a bear. Do I need to fight the bear, or do I lay down and play dead, or do I run away from the bear? So our sensory system is really, really important in everyday activities and what we do. So actually, I'm going to go back to this slide just for a second and kind of add in there, because I had gotten to talking a little bit about that fight or flight system. When we're talking about a child who has sensory processing problems, what that means is that something in this system is not working correctly. Right, so either at the intake part of this cycle, where they're taking in the sensation, they might be detecting too much or too little. At the processing point, they might be misunderstanding the signals that are being sent to their brain and misunderstanding how they should respond, and or they could be responding inappropriately to a sensory input. So for example, if any of you have children who are very defensive to touch, then maybe when they're in the classroom, if little Joey gets too close to them, too much in their space, their body detects that as, oh, somebody is attacking me, and the response is to hit Joey. So that would be improper processing and response of sensory input. And that's when we start to get concerned about sensory processing problems, is when it starts to really impact a child's ability to learn and to participate in their daily activities. So something that Dr. Gray and I talked about that we felt was really important is exploring your sensory systems a little bit. And so I'm actually going to change my screen here real fast. And then I will reshare. And so I know the Parent Center sent out to everyone a copy of this checklist. Sarah, can you see that? Okay. So hopefully you all got a chance to fill this out. And if you didn't, if you would take a minute, and if you didn't get it off of your email, you can kind of read through it here, and I'll just kind of slowly scroll through. But what we'd like for you to do is go through this checklist, and you're going to mark the items below that use to increase or decrease your state of alertness. Or if it sometimes makes you feel a little yucky, that would be increasing your state of alertness. If it makes you feel like you need to withdraw, then that would be a decrease in your alertness. So what I'd really like for you to do is at least go through and check some of these and see, are there some things that you do on a daily basis, or are there things that bother you on a daily basis? Because we really want you to understand your sensory system. When you've done this, what I would love is if we could use the chat box maybe right now, and I would love to hear from parents reflections on your own sensory processing. So are there things that really bother you during the day when you're at work? Do you find that you're somebody who needs to fidget in your chair at work or chew on a pencil? So go ahead, and if you guys can, I would love it if you'd put some comments in the chat for Sarah and I, so that we can kind of have a little bit of a discussion about what your sensory systems like and don't like. So I'll give you guys a minute to go through this and then to go ahead and start sharing in that chat box. I'll scroll down a little bit. All right, so we've got somebody who said they'll drum their fingers on the table to keep themselves calm. Great. Oh, that was from Leslie. Thanks, Leslie.
Yes.
Anybody else? Even as you're just going through this, if you want to just type some things in. So we've got a parent saying, seek out oral sensory. So choose on pebble ice, bites pen caps, likes to smell things to calm themselves down, bites nails, picks at the cute. Oh my gosh, Mindy, I pick my cuticles too. It's terrible, isn't it? I do the same thing. Anybody else want to share some things that they do for self-regulation? You know, it's the worst. All right, I'm just going to give people another minute to kind of see if they can come up with anything. I'd love to hear from a couple more people. Okay, so Ashley's saying she reacts poorly to almost all of the auditory stuff. Oh, Sydney's saying she didn't get the, and that's okay, Sydney. You can, if you can kind of read what's on my screen and pick from those. Music is a big way that Becky regulates or amplifies her feelings, such as sad songs when you're in a sad mood, loud songs when you're angry. Mindy says she's got a lot of these on here. There's going to be a lot of us who do a lot of these things. So as you guys can see from this, we all have different ways that we regulate our nervous system. We all do different things. So if you're somebody who you're sitting in a meeting and you lean your head on your hand, you know, you're providing deep pressure through all those joints through your arm. And that's one way that we regulate ourselves. Some people cross their legs or fidget with their feet. So there's lots and lots of different ways that people use to regulate themselves that don't look any different than something somebody else would do. But some of our kiddos will use things that might make them stand out in a classroom situation. Sydney says she bounces her knee sometimes. Yeah, so we all do these different things to regulate our nervous system. And a lot of times our kiddos just don't know how to do them in an appropriate means in a classroom setting. And so that's one of the roles of occupational therapy, is to help teach our kiddos how to appropriately regulate themselves in the classroom. So, all right, I'm going to go ahead and change my screen again. Close this one. Okay, here we go. Okay, so we should be back to the presentation here. Okay. So, sorry, I've lost count of what slide we're on.
It's my turn,
It's
Rhonda.
Sarah's turn, so Sarah is now going to take over.
Okay, so we have this basis that we just talked about for sensory. So now we're going to talk a little bit about school-based and what that looks like in terms of meeting your child's sensory needs. And so in general, we have on here like how do you know if OT is needed in schools, right? So basically, when it comes to sensory processing, it's part of that whole multidisciplinary, comprehensive IEP team evaluation, right? So initially, everybody's kind of gotten together and they're like, hey, who needs to be a part of this and who should we bring in? And so that's when the team itself decides, hey, we need to have OT look because maybe we have some sensory stuff, okay? So from there, as an OT, what you're looking for, right, is you're doing observations, you're doing sensory checklists, perhaps. You really need to consult with the teachers and staff because sensory is such a thing that is happening daily, right? And if we come in, OTs, we know a lot about it, but, right? And the OTs on here are probably going to know what I'm talking about here. You're not going to spend 4 hours in a classroom doing an observation. You get snapshots of a kiddo. And so you're going to need to rely on input from all the rest of the team members and the staff, including, paras are great because if your child has a para that's with them a lot, they're in the lunchroom, they're at recess, right? So you can get some of those high sensory environments, PE, and get some information. And then you can go to those formal assessments and evaluation. When you're considering sensory, it's really important to kind of also keep in mind that there are things that can impact what you might get out of that evaluation. So like if a kid is going through let's say a med change, you're going to need to take that into account because if they're kind of not stable right then, right? The meds are coming out of the system, they're coming in. And so these are the things that the OT is going to know to look at. They need to be with that teacher for a while for them to understand them and be able to fill out. So, if the kid's been there for 2 days, it's probably not a good, right? You're probably not going to get a lot of feedback because the staff doesn't know them. So those are like some things that need to be, talked about in the team as that goes along. And then, once you do this big comprehensive eval, you all come together and you talk about it. And so the team gets to decide, like, is OT needed? Let's talk about this. What does it need? Now, as we're talking about straight OT, I think it's important to also point out that just because OTs have this huge bag of tricks, right? And so if you get on AOTA and you look at all the things that OTs do in school, it's like this, right? Like executive functioning and all these things. But keep in mind that it really depends on who's on your team as well. Because if your team has some people who are really good, like I've had teachers who have had such sensory training that they can try some stuff and they kind of know, hey, I'm going to pull out this accommodation. It's great. And so they don't need me to come in all the time. So you really need to sit and look at the team and figure out who's got the qualifications to really provide support in these areas and what level of that support do they need. Okay. So Rhonda's in charge. So we included this slide because we feel like this is a real important distinction to make as far as just straight school-based OT versus clinic-based OT, because I think sometimes it can get a little confusing. So school-based OT is really focused on the educational needs of the child, right? They can provide some advice to home, but really the focus is on how can I get this kid to access their education and get what they need. So we're looking at providing accommodations mostly for sensory processing in the educational setting. So when you get on and you see this sensory integration and all these like swings and jumps and right, like that's outpatient. And that takes some special training. So they're not necessarily, the OTs are not necessarily going to fix your kid's sensory system. They're going to help adapt things and provide accommodation, give them some skills, some coping skills to help them access their education. So if you really need the sensory integration piece and home help, clinic-based is really what you need to seek out. We also provide support and education to the school teams to make sure that they know what they need to do for the sensory, and provide them support and say, hey, how can I help, get Jimmy to sit in his seat for you so he can make it through circle time, or whatever that is, okay? And in the clinic, we're really looking, we might look a little bit at the education, but the OTs there are also like, what's happening at home? How can we help them sleep? Right? So the thing I think that take away from this is that as a parent, oftentimes you get some conflicting, like you go to the doctor and they're like, oh, this kid needs, all this stuff in school, but school's its own environment. And that really needs to be, dealt with at the IEP team level, because it's kind of a universal thing. Or my other thing is, well, they're getting school OT, so they don't need clinic OT, right? I've had physicians, maybe weigh in on that. Well, that's not necessarily true either. The school is not going to be there to to do everything your kid needs. And so realize that, when you're in an IEP meeting and a school-based OT says, here's what I want to do, they're focused and their recommendations are coming from that standpoint of accessing their education. So this is not all inclusive, right? But this is a list of some things that we have provided as accommodations for kids in school. What I want to say is that nothing is a one size fits all. So just because, a kid's used a wiggle cushion and they had success doesn't mean that the next kid that comes along, you're going to have that same success. There's an element of trial and error, and making sure that accommodation fits their needs. It also requires really paying attention and being purposeful about how you use these. So having data collected is a big deal, especially when, the OTs, right? Some of you don't get to see your kids weekly, right? When you come in and want to know how something's going, you need something more than, well, it's going okay, I think it's okay. So that you have data to make the decisions on if something is working, or if it's not, okay? So some of the things that we have here is even as simple as preferential seating, being near the teacher or away from a distraction, what we like to call sensory seekers. If there's two that really need a lot of movement, you probably don't want them sitting next to each other and feeding off of each other in the middle of class. Testing in quiet settings, use of fidgets, movement breaks. I will say, you guys can read these, so I'm not going to read the whole list, but I will say too that there needs to be parameters placed around sensory accommodations, right? School OTs are going to nod on this one too, right? Kid uses a fidget. Yes, thank you, Marianne. Yep, it's right there. No, don't please remove recess. But, and see, now I lost my whole train of thought. They're tools, right? And so I always make sure that the kiddos I've worked with understand that just because you have a fidget doesn't mean you get the fidget all the time. Doesn't mean that you get to play with it when you want to. And if it becomes a distraction, then it no longer gets used. We find something else. So that tool versus toy talk is really important to kind of frame it, because I think sometimes kids will get sensory stuff and they don't have any expectations put on it, right? And then fidget is flying around the room, right? Wiggle cushion is on the floor, on their head. It's been popped with a pencil, right? All those things. So I think that's an important thing to include in any accommodation that you do. We'll go on. All right. This is the fun one, right? Sensory versus behavior. So how do you tell if it's sensory and how do you tell if it's behavior? Question of the day. It's difficult and it depends and it's hard. And most often sensory and behavior aren't necessarily like split, right? We've reinforced sensory behavior because they can, you know, they're avoiding something. And so you kind of get this tangled net and you kind of have to come at it from both sides. So that's the biggest key, is to have that comprehensive evaluation, right? That sensory observations, the sensory profiles, the sensory motor stuff, those kinds of assessments. Sometimes you need to look at the executive functioning. How are they planning? How are they organizing? Is it sensory or is it a cognitive need? And use those standardized assessments. So this really needs to be completed with that whole IEP team focus in mind. Now, as you're going along, you might need to trial and error a little to see also what might be sensory behavior, right? You might come to a point in your evaluation and meeting and be like, we still don't know, right? Like it's still pretty complicated. And so then you're going to have to work together to kind of do some intervention and treatment to help that out a bit. So one of the things that I think is really underutilized in schools is getting some sensory strategies on behavior plan. Okay, so we need to really take a look at what's causing that behavior, right? So you get your functional behavior analysis, everybody's looking at what's going on. If sensory is a part of what you think is contributing to a kiddo's needs, it's really good to have it in, like, you know, the things on the behavior plan that like preventative strategies, right? Maybe they need some sensory input throughout their day and you're going to keep that fight or flight system down a little bit. And it reinforces it, right? And it reinforces this concept that what we see a kid do is behavior, right? So when we see sensory issues, we see whatever that behavior is that's coming out, right? Hitting, avoidance, seeking, movement. You know, when we were doing that adult checklist, I'm the one that's on the opposite end of many of you. I need more all the time. And I've had to learn to be functional in meetings, right? I can't spin my chair and listen to loud music in the middle of a meeting. So, you know, we've all learned to accommodate that. And so the other thing I think we need to do is make sure that we're keeping data, right? Keep data to determine the most effective strategy, because one size doesn't fit all, like we said before. This can get a little challenging, right? Lots of meetings, lots of buildings. Your OT has 15 buildings, but I think it's really important to bring them in and have them be a part of that behavior plan. So next slide, please. I feel like this is like a Vanna thing. So at the end of the day, who's responsible for a child's sensory goals? So I'm going to give you a little bit of my soapbox. So how many times on an IEP have you seen two goals that are very similar? One is the behavior goal and one is the sensory goal. So at the end of the day, what really needs to happen is it's the child's goal, right? So what behavior am I going to see if we've implemented our behavior strategies right, if we've implemented our sensory strategies right, and they're in harmony, we're going to see the kid be able to sit and attend to a task for, you know, X amount of minutes, complete that paper, turn in their homework, right? Whatever that need is. And so for me, it's really a refocus from everybody has a compartmentalized goal to realizing that what we all bring to make that goal happen. And so really the OT seems to always be responsible for those sensory goals, but sensory has to be implemented throughout the day, every day. And so you really need the help of everybody involved in the team to kind of pull those, you know, you can't pull the kid out half an hour a week and say, hey, we did some sensory strategies and they never use them, because then you're not going to see any change. So I think it's Rhonda's turn now.
I think it is too. But I think those are some really great points that Sarah was making. And I think if we can pass anything on to you all as parents this evening, in terms of IEPs, it's this idea that IEP goals belong to your child, not to the team. These are your child's goals. These are where you and the team and your child hopefully would like to be in a year's time. And so every single person on that team is working on that plan. It's never, you know, a math goal is never just up to the special education teacher, right? Even the OT might have a role in your child's math goals. So I think that's really important to think about in terms of no goal belongs to any of the professionals on your team. So within that, then how do we provide services as occupational therapists in the school? So there's a couple different things you might hear. And I saw that a parent had asked about 504 plan and having needs. So we'll get to that as well. But how are services provided? How do we decide how many, you know, we don't have a dartboard. We're not throwing a dart at a dartboard saying, well, this child gets 20 minutes of services a month and this child gets, you know, nothing. There really should be good clinical reasoning behind why your occupational therapist is choosing how they're providing services and how much time they're spending with your child. And it really should be based on your child's needs and what kind of service is the best fit. The one thing I like to help parents to understand is that sometimes I think we get a little bit stuck on like direct services have to be the best, like that OT going into grabbing my child and pulling them into that little magical OT room has got to be the best way for my child to receive OT services. But we find a lot of times, and what our research is really showing is that a lot of times the OT pulls your child out into that magical OT room for 30 minutes a week or 20 minutes a week, and then walks them back to their classroom, and there's no generalization of what they learned in the OT room back to that classroom. So for that reason, consultative OT services, or you might hear it called indirect OT services, that's actually, as a school OT, that's one of my preferred methods because it allows me to go into the classroom and teach the teacher and have a conversation with that classroom teacher on a regular basis saying, hey, what's happening with this kiddo? How can I support? What can I problem solve? I can do some observation. Now it only works if people actually do their consultative services. So that's, and obviously for all of these things, the OT has to be doing their job and following through and being consistent with the team. So you will see usually that consultative services, your child would get less of those services usually with a bigger impact. So you might have an OT that writes 20 minutes a month of consultation because they're going into that classroom and spending 20 minutes a month really making sure that things are being implemented and really training the teacher and supporting the teacher so that they can be the ones supporting your child. Direct services, from my experience, and Sarah, you can maybe chime in here as well. I'm seeing within Utah in the years I've been here, anywhere from 20 minutes a month of direct with some motor aid support up to 30 minutes a week. Is that kind of, Sarah, what you've seen in your history as well?
Yeah, and it really depends. Like sometimes there's been like 30 minutes a quarter with it's very variable. So
and I think that's a really good point, that it is variable and it should be variable, right? And it should be meeting what your child needs, not necessarily, it shouldn't be well, everybody gets 20 minutes a month, that's how we do it. Or everybody gets 20 minutes a quarter, that's just how we do it. It should be specific to your child because it's in their individualized education plan. So it should be individualized to them. If your child does not qualify for an IEP, for an individualized education plan, and they have a 504 plan, OT services can be provided as an accommodation. So it's not a super common thing. I do it occasionally where I will have kiddos who are seeing me once a week for direct services to work on fine motor skills under a 504 plan. The goal there is to get that student to a place where then I can just get some accommodations in place and help them be successful in the classroom eventually. But sometimes, especially for my sensory kids, if they have emotional regulation challenges, then sometimes what I will do is I will go ahead and put some services on a 504 plan to teach them some emotional regulation and self-regulation skills. And then we will move that to eventually a consultation with them, and then eventually just to those accommodations that they've learned that are helpful. It's really important for a parent to understand, and I know that as a parent, this can be the most frustrating thing, and I'm going to tell you, OTs share in this frustration, is that occupational therapy cannot stand alone on an IEP. So your child may not have OT services on an IEP all by itself. We are what's called a related service in special education, and what that means is we have to relate to something else. So if your child has speech therapy services, and there's a way that we can relate to those speech therapy services that are being provided because maybe they have an articulation delay and a more global motor delay, then we can relate to that and provide OT services. If they're receiving any other kind of special education, we can usually relate to those services if it's appropriate. But I think that's a really hard one for parents sometimes, is when you see that fine motor or sensory processing are the main things that are impacting your child's education, and you just want to get them some services to help, and the OT is going, I can't stand alone on this IEP. I can't, I'm legally not allowed to. But again, I would then look at, as a parent, I would recommend that you look at a 504 plan with the school counselor to see if that is an appropriate means of getting your child accommodations. Okay. Oh, and that's what my next slide was about. I just jumped ahead on myself. So, and then again, if OT services are standing alone on a 504 plan, they might be direct consultative, or they might just be to provide accommodations in the classroom. So there have been times where I've had a kiddo, they've been on services for a while, we've figured out what sensory strategies work for that child in their classroom, they're good to go. They move on with their 504 plan that just has those accommodations, and then they don't need me anymore. And Sarah, I talked about yours. Did you want to talk about this one?
You're totally fine. We'll just go with it. So
okay.
Here's the more services are better, right? Like more is always better. Well, not necessarily, right? That's why there's a whole team that brings a lot of expertise and a lot of different things to the plate that can help your child, and really, like I said before, figuring out who can be the best support for that kid to make them the most successful. And so the thing that, and Rhonda has sort of spoken to this, is that sometimes consultation really is more productive than having your child pulled out, because you can get the daily follow through, right? When they're having the meltdown, they have, right, this natural thing to start learning, how to read their body, how to use the skills they have, and generalize them from place to place. And so I think my biggest thing too is just to not see consultation and indirect as always being less than, because it might just be the right fit. So.
Do you want to talk about this one, or you want me to, since I messed up?
Go for it. You're on board. Go for it.
So we touched on this a little bit earlier. Sarah talked a little bit earlier in the presentation about the difference between school OT and outpatient OT. And so the purpose of this slide is just to really help parents, as parents, for you guys to understand that there really is a difference. And Sarah and I have both done, schools and clinic before. So we've heard parents on both sides of the coin. So we get parents that would come into the clinic and they'll say, man, my child didn't qualify for OT services at school and I'm really confused, but you see all these other needs that they need at the clinic. And then vice versa, I'll be in the schools and I'll have parents being like, yeah, my outpatient OT doesn't, isn't addressing these things. And so sometimes there's it's really hard as a parent to understand like who is supposed to be doing what and where is each person's role. So I think, to go back to what Sarah said earlier, if you just remember that the school occupational therapist, their role is really to help your child to be successful in that school environment and to access their curriculum at school, and their environment at school. And so that is really the role of the school OT. These other things can be addressed if they are impacting home life. These are things that can be addressed by an outpatient occupational therapist. And you're not going to usually hear this from a school OT who's sitting in an IEP meeting. You're not going to hear them say, I think your child needs outpatient OT. And there's some legal ramifications behind why the school OTs are not going to say that to you. So it's just important as a parent to realize that you have multiple options for treatment interventions, that school is not the only place that can provide OT services. The other really important thing is to realize that, as Sarah said, school OTs are not going to be pulling your child out every single day and doing 45 minutes of sensory integration, Jean Ayres inspired occupational therapy, because that's not their role as clinicians in a school setting. That is something that an outpatient OT is going to do. So as Sarah said, you guys can kind of read through what the rest of this slide says, but the big picture here is just to remember that there are two different types of OT that can benefit your child, both in outpatient and at schools. I do want to say from this slide that your school occupational therapist is not to say that they can't address dressing and feeding as well. Because if you have a middle schooler or a high schooler and they need to dress down to go to gym, or they need to manage clothing to use the bathroom, or if they need to use the bathroom at school, these are all things that your school occupational therapist can help to support. Now, again, there's certain things that as a school occupational therapist, I'm going to want to give strategies to the teacher and to the paraprofessional and to the team that is there and with your child every single day. Because as the OT, I am not going to be available every single day to be with your child one-on-one, right? To take them to the bathroom and practice toileting. So it's more important that if we're working on toileting in the schools, that I'm in there with the paraeducator, with the classroom teacher, whoever it is that's going to be toileting with that child on a daily basis, to practice those skills and then teach the other adult how to facilitate what I would do. Same thing with dressing, same thing with feeding. So the important thing is that follow through for everything we do as OTs, I feel like. And so the more we can pull in the other adults that are in your child's environment, the better our outcomes will be for your child.
And I think I would also throw in there too, that having been on both sides, right, the outpatient OT and the school, I loved that when you had like an outpatient OT per se, or a school OT, that you would connect us together, because really having both of us together and collaborating is such a wonderful thing. And I like as an outpatient therapist, I love collaborating with the school OT. I loved collaborating with the outpatient, because it gives a much broader, well-rounded picture for us to kind of complement each other as it goes along. So
yeah, absolutely. Okay, so I just like this quote, so I put it in because it takes a village to raise a child, not a child to raise a village. It takes a village to raise a child, and that's what your IEP team should be. And it really should be about how your IEP team can support you and your child in your child's educational environment and setting, and how can we help your child to be the most successful. And so that is hopefully where all of the occupational therapists are always working from, is from this idea of how can I best support your child, and asking questions of your occupational therapist and of your IEP team, I think is so important, because it helps you to understand why they're approaching things the way that they are. Our last slide that we put in here, these are just some resources, and I think Leslie had said that we'll follow up with an email that has some other resources. So these are just some resources. The STAR Institute and the Spiral Foundation have just really great parent resource sites on their webpage. They have some of my favorite ones. They have some really good research, and each offer like some parent education courses. If you really want to know more about sensory processing, they do have some school-based ones as well that help you understand as a parent what sensory processing can impact in the classroom. And then they also have some things about different strategies and ways that OTs can help your child. So those are two of my favorite resources. Life Skills Clinic is where Sarah and I work, and then I put the Utah Parent Center on here as well.
Okay, well, everyone, thank you so much. If you haven't had a chance to fill out the poll, please do so, and I'll leave it up for another minute or so. And thank you, Rhonda and Sarah. It's been a wonderful evening with a lot of information. We will be sending out this information from tonight's presentation. And if you haven't had a chance to fill out that sensory profile for yourself, go ahead and do that. It's very eye-opening. And now every time I do one of those things, I think, oh no, what am I doing? So it makes you very self-aware. So that's a good thing. But anyway, all right. Good night, everyone.
Thank you, everybody.
Thank you, guys. Thank you for listening.